My name's William, this is Jazzy and John. Our report is on Unit 4, Disaster Medical Operations Part 2. First we have public health considerations, that's John's. John?
Which is maintaining hygiene, washing your hands, wearing gloves, masks and goggles too. And then for water, if it's dirty, get some bleach. Drop about 8 drops in there per gallon if it's, not too dirty. And then if it's real dirty, drop about 16 and then you're good to go. Drink away.
Then we got functions of disaster medical operations. I'm doing that one. We have triage, which is kind of like scouting. You're going through seeing who's injured, who's got major problems. So if they're like stop breathing and you get them to breathe again, you tag them red. If you can't get them to breathe again, you tag them black for dead. Black for dead, and red is immediate. Yellow is standby, kind of, and then green is good to go. So they can get up and walk around, probably help around. Then you have transport, that's getting people from place to place, or dead bodies, depending on what they're marked. Treatment, that's what me and Jazzy do, and I think he's in triage. Me and Jazzy treat the wounded, and if it's in a light damage building, we'll sometimes treat in the building. If it's a moderate damage, before we can treat anyone, we have to get them outside. Then the morgue is where we send all the dead people. Then we have supplies, which is like our masks, our gloves, and all our major stuff. And then I pretty much just went through all this with that, except for ABCs and wound care. Our ABCs are airways, breathing. And then we got bleeding, controlling bleeding. It's like, if we get a massive wound, we got to put pressure on it. Circulation, that's shock basically. Got to treat someone for shock, flange test. Wouldn't really work on me. No one can tell what color my hand is. Then we got patient evaluation. Jazzy?
Patient evaluation, the subjects that go in is immediate care, delayed care, minor care, and morgue. And you put somebody who's dead in the morgue, and minor care would be that they just had a few scratches, and delayed care would be they were yellow and they had maybe a broken leg or something. And immediate care is if they're in shock or they're bleeding a lot and they can't stop.
Then we have the basic treatment. John?
Basic treatment is treating smaller, less severe injuries, such as burns or dressing wounds with bandages. Some fractures can be more serious than others, but some of them can be treated without a lot of work. And then hypothermia, warm blankets, all that. You could treat heat-related injuries like strokes or heat stroke and whatnot. Control nasal bleeding, plug that up, all that. Treat bites and stings if you're allergic. You gotta get that epinephrine and all that in you, and then good to go. That's about it.